Staying with the fight against COVID-19 earlier, our colleague Gloria Mutesi sat with Rwanda's Minister of Health to ask him how things are going 3 weeks after the mass vaccination program began here in the country. Let's take a look.
I think so far it's good. We expect to end our vaccination campaign this first round in 2 days. We had 341,000 doses for being given as dose 1. We gave so far 97% of it. So we remain with a few doses that we'll be able to vaccinate tomorrow and after tomorrow.
Okay.
Yeah.
And so when these people that have been vaccinated, when do they expect to get their second doses?
It depends with the type of vaccine they received. Those who received Pfizer, they should come back after 28 days. Those who received AstraZeneca, they are normally expected to come back between 8 and 12 weeks. But for each one, we have all details regarding the name, phone number, the health center or health facility where he was vaccinated, or a special site where he was vaccinated. So we'll make sure that we give information on time to each one so that each one will know ahead where he should go for a second dose.
And after this phase of the first vaccination, when should we expect other people or other categories to be vaccinated? And also on that note, will there be a provision for if people can afford the vaccine, they can get it on their own?
We received this first batch of doses through COVAX facility, but the government is also in process of getting its own vaccine through bilateral deal with manufacturers of vaccines. So we expect in coming weeks, a certain number of doses from AstraZeneca and Pfizer, both by the government. But also we expect additional arrival of batch of vaccines from COVAX and the African Union mechanism. So we have 3 mechanisms from which we expect getting additional doses. And now regarding anyone who can afford to purchase the vaccine, so far vaccine is free, it's for free, it's given free of charge, and the government is willing to continue like this. I don't know if there is anyone who wants to spend money just because he wants to spend money, but we are giving the vaccine for free.
And it will continue that
way? And
way?
It will continue like this one, yes.
Okay. Well, there's been reports of a new variant that was identified in South Africa and other European countries. There's been reports that it has also reached Rwanda. What do you have to say about that?
Since the arrival of this virus in Rwanda last year in March, we set a program, a surveillance system of monitoring this virus, including sequencing the virus so that we can track type of virus in the country. We used to have few mutation, but without any concern. We had some lineage similar to the virus we had from the beginning. And around August, September, and November, where people started to talk about UK and South Africa variants, we strengthened again our system of tracking virus, and we were able to sequence up to 400 samples of virus.
By sequencing, you mean?
By sequencing is like we want to know deeply the nature and the structure of the virus so that we can identify which virus has a mutation of concern. Because having mutation for virus, it's quite normal. It's their way to survive.
Yeah.
But at one point, virus can have mutation subject for concern. Means what? Means the virus became either resistant to the treatment, either resistant to the vaccine, or it increased its capability for transmission. These 3 parameters are really determining a virus of concern. So while doing it, recently we had we were able to sequence a certain number of samples, and we found 2 samples with UK variant and 10 with South Africa variant. And all of these samples were from people who arrived at Kigali International Airport. They were tested positive at different period, of course, at their arrival, and they were, identified as positive cases in the morning after less than 24 hours after the testing. And as usual, they were isolated until they were tested again, then declared without virus.
Okay.
So it means these people were from abroad. And so far, we are doing the same exercise in our treatment centers, and we didn't discover any variant of concern since August up to now. And we continue this system of surveillance and making sure that we don't have any virus of concern among the population in the country. This is a serious issue that we should really monitor, and we make sure that time to time we have this sample collected and sequenced until we are able to say some of them are just normal virus that like we do have so far, and if there is any subject of concern, we'll know it and inform.
So you say that the virus keeps mutating and changing over time.
Yeah.
Does it pose any threat or risk, especially to you scientists or people that are at the front line of the fight against the pandemic in the spread, and how does that affect the spread, and also how you guys move forward with that?
Yeah, it's a subject of concern because you never know what kind of mutation will be there, and with capability of resisting to the treatment. You have seen that there is decrease of death recently due to treatment that we are giving to people affected with COVID. We are now coming with vaccines. So so far we are convinced that, and we believe that these vaccines are safe and strong enough to contain this existing virus in country. So we don't want to have this virus of concern because there are some speculation or there is a probability that they might not be sensitive to the vaccine. So it's really a subject of concern everywhere, and you can see that in countries where there are so many this virus of concern, despite strong campaign for vaccination, here and there, they are still concerned with, again, number of cases still increasing to the point of even going for lockdown, etc., etc. So it's a subject for concern for all of us, for all scientists, for all people responsible for health in different countries. So that's why we are really reinforcing our system for surveillance, of genomic surveillance, so that we know the structure of the virus in the country, and then we can share this information. There is a database, international database, where we upload those information. And Rwanda is among 25 countries giving information on regular basis, and among 3 African countries giving it regularly. So it's important because researchers, manufacturers of drugs and vaccine can get information and then probably adjust their vaccine accordingly so that vaccine remain enough strong to contain the spread of this pandemic.